Hello, I'm Liz Harry. I'm from the University of Technology, Sydney, where I'm a professor of biology. I work in an infectious diseases institute, and I'm very good friends and collaborators with Shona Blair and Narelle Chokchetan, who have given talks before me. I thank them for introducing me to the world of honey. 15 years ago, I would have laughed if you'd have told me I was going to be working on honey. But research in honey's become more popular, and there's a lot of rigorous science, both bench science and bedside clinical science. And we're finding out more and more about the benefits, the health benefits of honey. And I want to talk about this with respect to chronic wounds. So chronic wounds are an unsolved health problem. And I'm talking about not the wounds that you graze or cut yourself and you put a Band-Aid on and they heal within a few days, maybe a week max. I'm talking about wounds like this diabetic foot ulcer that will last for some time, probably more than 3 weeks or more than a month, and some can last many years, and they are more resistant to healing. They affect almost 500,000 people in Australia. It is a hidden problem, so these people tend to be less mobile. Some of them are not very well or older, so they're not as mobile. And one thing that I'm going to talk about here is one of the really debilitating symptom of chronic wound is the odour. Some wounds have a very bad smell, and this stops people from seeing anyone because they're embarrassed and they feel dreadful about it. It costs $3 billion a year in Australia, healthcare for wounds, and some of this is out of pocket for the people that have them because there's a lot of wound care products. They're expensive and they're not reimbursed. There's increasing prevalence of chronic wounds with ageing, with the increase in aging population, with obesity, diabetes, various surgeries, and so on. So does honey work? This is an example where this person, 88-year-old woman, has leg ulcers, which happens in older people when they have, often when they have circulation issues, treated with honey. Now, this person had had ulcers for 20 years, painful, often smelly, awful to have and to have to keep dressing. And what happened with this woman was it was refractory to all sorts of conventional treatments. And after 10 weeks, you can see that the wound has beautifully healed. So there are many case studies like this to give us at least some initial evidence that there is a place for honey in the wound clinic. So what we've shown previously are a few things, and we've worked on the antibacterial activity with Shona and with Narelle. But we have also looked at biofilms. And sorry, I've missed a slide. So what I wanted to show you or tell you was that bacteria tend to exist as communities, and these are called biofilms, and they're very well known now. And they tend to form these biofilms everywhere. And when they're causing infections in wounds, then this halts or slows down the healing of the wound and causes a lot of the symptoms. So free-floating bacteria settle down on a substrate and form a community. And you see here a bacterial biofilm on a urinary catheter. And it's now thought that 80% of bacterial infections involve biofilms. This is a large amount. They're notoriously difficult to treat. And one of the reasons for this is because they're highly resistant to antibiotics. So you can see here, this is an antibiotic trying to shoot and obliterate a biofilm. And one of the reasons why the antibiotics don't work well is because the biofilm, the antibiotics can't penetrate the biofilm because it forms this slime around the cells. So this is a real issue for chronic wounds and them not healing. I think I have missed a slide. So the other thing that, what we have shown is that honey eradicates biofilms. So we did a laboratory-based study where we grew cells in a biofilm-inducing situation. And you can see here that we've stained the cells with green and with red. Here you see the two stains together. This is microscopy showing a layer of biofilm that we've created of Staphylococcus aureus that is found in wounds and on our skin. And the live cells and there's always some dead cells in these particular situations. So with no honey, we see lots of green. When we add Manuka honey up to 32%, you see that a lot of the cells have gone and the biofilm is pretty much disappeared. Now, we quantify this, and we can show you this by looking at the fluorescence and the quantification of that. We also show that we know that when biofilms attach and form this and grow into mature biofilms, they then have a cycle of releasing free cells, which then come back again and attach, find a new space, and grow again. So this is a constant cycle. So we wanted to be sure, apart from eradicating the biofilms, what has happened to the free swimming bacteria? And sometimes what people have found is that these free swimming bacteria become more tolerant to antibiotics. What we found when we took these free living cells from the biofilm, that they are just as sensitive to honey in terms of both stopping their growth and in terms of stopping them forming another biofilm. So this is really, really good, because this is what would be happening in the wound. Of course, what we'd like to do is more studies in the wound, and this is going to be part of the next project that we look at. So what I want to talk about now is a particular type of wound that a while back, when I heard a talk about these malignant or cancerous wounds, really was very upsetting to hear, because of the symptoms that these people have when they have a limited time in their life. Now, I'm going to show you a rather awful wound that is a cancerous wound. So please, if you don't want to see it, and there's a couple more to come, please look away. This is a rather awful breast cancer wound. So malignant wounds are caused by the infiltration of the skin by the tumour. And this is a really issue for 10% of advanced cancer patients. They cause extreme distress. As you can see, they remind people of the cancer. They also look awful. And there are some awful symptoms. One of those, which is overwhelming, is malodor. These wounds smell because they produce a lot of liquid, and they also have a lot of bacteria in them, which I'll come to. And they have other symptoms. A lot of liquid comes out of them, which is called exudate. Sometimes they have to use all sorts of absorbent towels to absorb this exudate. And again, it's very distressing. There's a lot of bleeding because the tumour is got a lot of blood to it, and there's also pain. And there's very little research on how to manage chronic wounds in general. These particular wounds, malignant wounds, get very little attention. And we're interested in how we can improve the quality of life for the people and their loved ones. So the other thing, please avert your eyes if you don't want to see these wounds. They're pretty awful. So can honey help with these malignant wounds? Well, there are several case studies in this, and we have talked to quite a few wound care nurses that say honey is really a go-to for them as part of the panel of wound care dressings that can be used. And I did mention before that the malodor is really, really quite bad. And two things that we're concentrating on here that honey is very good for, and others as well, is to reduce or eliminate the infection, because it's the infection, it's the bacteria that are causing the wound to smell. And can we reduce or eliminate the malodor? And honey has been shown in these case studies to do this. You see a cauliflower sort of appearance of the wound, which is typical of a cancerous wound. It's also called a fungating tumour wound. You'll see that it's severely smelly, as well as other things. And after some weeks with honey dressings, they find this nurse, a wound care nurse, has seen that there's no malodor, and it's gradually decreased in size. It looks a lot better. It doesn't smell. So this person can now go down with their friends down the street to have a cup of coffee. They can hug their loved ones. They can go out without having this smell around them. And really, this stops them from doing this. So what we wanted to do was start a new project on, can we really test whether honey helps with malignant wounds? And as I say, there's very little studies in this space. So what I have embarked on a year ago, and Narelle is involved in this as well, is a bench to bedside project. I've never done this before. It's very exciting and very challenging. But the end result is to improve the quality of life for people with these wounds. I have a team of about 15 people at the moment, and our aim is to investigate the effectiveness. Sorry, keep doing this with my slides. Is to investigate the effectiveness of medicinal honey dressings for the treatment of malignant cutaneous wounds. Yeah. So we want to improve the quality of life. That's our ultimate goal. And we're working with cancer symptom trials, which is funded by Cancer Australia and set up at UTS, but it works across Australia. It's a wonderful team. And we're also carrying out a rapid clinical study, which is set up by a palliative care group at UTS. And at the moment we are looking at what is the state of affairs for what nurses do for malignant wounds. So we're taking information data from various people with malignant wounds that are being cared for to get a bit of a snapshot of what's actually happening right now before we delve into the testing honey. We're also writing a systematic review. In fact, we're writing a couple of reviews of what's already known, what is the data that's out there, so that we can inform the clinical trial. This is also important for getting funding. And we've had a malignant wound workshop where we have international people feeding in to tell us, yes, it's a problem. And there are various countries where this is also very important, particularly in low to middle income countries where people present with malignant wounds for the first time when they get a diagnosis. And we're also designing a clinical trial. So in doing this rapid study, I don't know why this keeps happening, keeps missing slides. So what I first learned when I started this, I just wanted to use honey in a clinical trial. The wound area is far more complex than that, as are most areas when you start to look under the carpet. We're getting a snapshot of the current situation. And what we found with discussions with clinical nurse consultants in wound care and physicians is that there are many other issues with wound care. And it's not just about clinical trials. Consumers also have informed us for how they felt, what's important to them. These are patients, past patients, and also carers. And we have them involved. We also have nursing academics who've done research in the clinic and in wound care. And so we have that expertise on board. And we've arrived at a set of measurements that are relevant to the intention of the study. Okay, so it's become broader than honey. And this is really exciting. So honey is still at the center of these things, of this study, but it's become much bigger because there's so much more to it. And it has ended up being a transdisciplinary project, starting at UTS, but also now building out. We've got one member at University of Melbourne, and we're working across health, business, engineering, humanities and social science, and also with industry. We have established a really good relationship with industry who are prepared to give us honey dressings free of charge to use in the clinic. So we have quite a few questions here, and we're building this partnership. We have no funding yet, and we're at the moment, we have it off the ground, but there's more to come. And I hope in future Apitherapy conferences, I can actually tell you a little bit more about this project and how it's progressing. Of course, no one does projects on their own. This is all about the team. And as you can see, at University of Technologies, there's a whole range of people, including professional staff, who are just gold to work with and so talented. And I thank them all for committing themselves to this project. And Susan Kapp, who is a clinical nurse consultant and academic, who has been brilliant and a new addition to the team. Shona Blair, of course, for introducing me to the world of honey, and Dee Carter at University of Sydney. We call ourselves the Honey Team in Sydney, and we're great friends. I thank all these people here who have introduced me to the world of wound care, the ARC, who have funded some of the honey research, and Convita that I've described, and Convita who've also funded with ARC some of the honey biofilm work. I thank you all for listening, and I've recently become a native bee keeper, which is extremely exciting, and you know, that is a positive outcome of COVID, I guess. Thanks very much. And I think I'll be taking questions next. Take care.